So we have discussed the obvious disparities among African American women with regard to maternal health. I think a controversial aspect of this topic is the prevalence of discrimination that is associated with lower quality of care and mortality. In an attempt to combat the discrimination, the International Convention on the Elimination of All Forms of Racial Discrimination, or ICERD, was established in 1969. It has since been ratified several times. It was intended to guarantee that the U.S. Healthcare systems were free of racism, yet little was done to honor the commitments that were outlined, and it has failed to implement any, and discrimination remains prevalent. To better understand the role that racism plays, the Center for Reproductive Rights and Sister Song Women of Color Reproductive Justice Collective, these two groups made an attempt to provide insight to the problem. And in 2014, they released first-hand narratives of African American women's experiences with reproductive health and racism. It was through these narratives that the inequalities were revealed in the healthcare system. So these narratives, one of them depicted, many of them depicted stereotypes with birthing experience. One woman recalls giving birth to a child with deformities, and for her it was a very difficult situation. Staff then proceeded to remove the child and refused her access until she passed a drug screening. She believed she was targeted for being black, and this was her fifth child at the age of 25. Others recall experiences of stereotype towards that lead to mistrust in the patient-provider relationship. So many of these narratives depict women being denied pain medication or not being believed when they are in pain. There was many stories such as those. Also, medical professionals would lie to women and even withhold information from them. And in turn, there was a higher rate of unnecessary procedures such as C-sections and hysterectomies performed. It's important to note also that education and socioeconomic status is not necessarily an indicator, because women with higher economic status, who are more wealthy, or who have a higher education, are still susceptible to these disparities just for being African American. Another thing I found interesting was something called the weathering effect. So this is stressors that women may experience throughout their life from racism that can actually trigger physical processes that will affect their maternal health. So these two groups released this information with the goal of not only trying to initiate policy change, but they really wanted to focus on increasing coverage of uninsured women, improving access to maternal health and education. Education was prenatal, postnatal, as well as sexual education and reproductive education. And another goal, which I felt was very relevant to us as nurses, is that they believed that training should be provided for healthcare professionals to avoid racial stereotypes.